Hi, we're at Astro 2024, and I'm here with Dave Greenwald, and we're talking about BNCT. Dave is the CEO of Aviko Therapeutics, and they're partnering with Neutron Therapeutics to deliver accelerator-based neutron therapy. Do you want to talk about accelerator-based neutron therapeutics,
Sure.
Dave?
Yeah, thanks, Rock. So for a long time, BNCT has been implemented using nuclear reactors for the neutron source. And recently, though, there have been developments for accelerator-based neutron delivery. And Aviko has partnered with Neutron Therapeutics, which manufactures the NuBeam system for BNCT clinical treatments.
And tell us why Aviko, a pharmaceutical company, is interested in boron neutron capture.
Yeah, well, the clinical data generated out of Japan and Finland and Taiwan has shown really promising clinical data on difficult to treat cancers. So recurrent glioblastoma, recurrent head and neck cancer, and other cancers like breast cancer, really difficult to treat cancers that have patients who have failed previous lines of therapy have had really good response rates to BNCT. So we've been very encouraged by this clinical data.
And so tell us about the promise of new drugs coming in the field.
Yeah, so traditionally BNCT has leveraged a drug called BPA, oral phenylalanine, and BPA has been around for a long time. It's an effective drug. We think that there's room for improvement in terms of improving the drug-like properties, things like solubility and the targeting to cancer cells. And so, we think that there's a lot of opportunity to develop new drugs, not only to leverage the same receptor that BPA uses, but other receptors on cancer cells as well.
And it's possible to put more boron onto a molecule than we have today, and that will lower the treatment times proportionally, I assume.
Correct. Yeah, there's all sorts of benefits on improving on the drug side. And so one benefit could be lowering the treatment time, but also you could potentially treat deeper seated tumors.
Right.
So the neutrons penetrate to a certain depth. The more boron that you can get to deeper seated tumors, the better opportunity you have.
And rotational therapy will also help because you'll be able to focus the neutrons better at depth and get more depth penetration than conventional reactor-based.
Correct.
And that's also helped, I guess, by the epithermal nature rather than the pure thermal neutrons you get from a reactor.
Yeah, absolutely correct. So, the epithermal neutrons are critical for BNCT. Traditionally with the nuclear reactors, the gamma radiation and fast neutrons really have no therapeutic benefit. And that's why one of the reasons that we partnered with Neutron Therapeutics is that they have, the NuBeam that meets all the IAEA clinical BNCT guidelines. Rock, your other question about indications is important, and this is why Neutron Therapeutics entered into an exclusive partnership with Leo Cancer Care for upright positioning. So traditionally, BNCT has been given in a supine position on a couch, and this limits the number of indications that we think can be effectively treated. Probably okay for GBM and head and neck, anything above the shoulders, but for BNCT to be commercially successful, we think we have to go after larger commercial opportunities as well. So at Aviko, we're developing drugs in our pipeline against triple-negative breast and small cell lung cancer. Those are two indications where it's critical to have upright patient positioning, and we're really proud to have partnered with Leo on this.
Well, thank you very much, and thanks for joining us today.
Yeah, absolutely.